The controversy on warm-up, my professional bias after many years of warming up, not warming up, ripping things that were cold and warm, I have 4 things. Warm up, yes. So, contrary to what you may read, warm up, yes. The purpose of warming up is warn your system for what you're going to start doing to it. You don't pull somebody out of bed at 5 in the morning and have them go dig within 30 seconds. You warm them up, you feed them, you get their blood circulating, then you hand them the shovel, and then you say, let's dig. Don't do that to your body within the first 10 seconds when you get out of your car and you got your shoes on and you're late and you're trying to catch up. Slow down, breathe, warm up, and you might have a different run or walk that morning. Cool down, yes. That's the way to do just the opposite. Tell your system, we're going to stop doing what we're doing, and we're going to do something else that isn't quite that active. Blood pooling, tissue loading really appreciates a graded cool down, and it doesn't have to be long, and it really depends on your physical ability and what kind of condition you're in. The worse condition a person is in, the more you want to get that message across. That's a longer cool down and a longer warm up. The faster your body can interpret the information, the faster that can go. Stretch after exercise, yes, that's the best time if you want to make something longer, because now it has been fed. It's blood is your fuel with many different factors in it. Your muscles now are paying attention, and then you can communicate them, stretch please. Prior to, when they're cold, they are not fed to the same extent. They're not warmed up from heat. Hot tubs are a great place if you're not too hot already to stretch out in, or warm water. Stretching later in the day, yes. You don't need to be as intense about it, but repeated stretching afterwards will maintain the stretch that you've initiated post-exercise. Here are the common lists when people present to our tables, and also on the medical website, and then in the clinic itself. We see blisters. First question is cotton. Answer is yes. Action is don't wear that. So in real short, I'll have this typed up in a little bit more words, but in short, cotton means blisters. If you want blisters, wear cotton. If you are not wearing cotton, you're getting blisters. That means high areas of contact. You want to disperse the weight of your foot over a large surface area. I always recommend BioSoft inserts. They give way. They don't work for everybody, but if you have a high arch foot or a very low arch foot that needs some posting, so the foot has a very even surface area of contact, those can be very helpful. Foot pain, it depends on the location. We have ankle sprains, knee pain, iliotibial band pain, hip pain, low back, neck and upper back pain, shoulder pain. 9 times out of 10 is a dog. If you're running with your dog and your dog decides it's ready to stop and go or chase another dog, work that one out. I don't know what else to say there. I have a lot of people that just, they run with their dogs, and that's a whole other category, but most of the time shoulder pain, usually the dominant holding side is from a dog bolting off and seeing something that you're not. And the side stitches that happen. Those are probably the most mysterious. There's a lot of stuff inside, organ tissue, muscle tissue, fascia, all kinds of material that can kind of bind and incorporate nerve tissue within it, similar like a callus would on your hand, making an adhesion. If there is live nerve tissue in that adhesion and you move, it gets pulled just like somebody poked you with a pen. And side stitches take a lot of experimentation on finding what works for you. So don't give up on those for people who have those. And sometimes they can be very chronic. On foot pain, on all the pains, today we have a short time, but I encourage you to do post or ask questions. The type of pain, sharp, dull, local, where it's in one area, or radiating. If things radiate down nerve track ways, that's different than if they radiate over a region. So low back pain that stays in the back like a belt line is usually the joints and muscles in the back. Pain that's on a single side that shoots down toward the foot is more of a nerve entrapment, disc, piriformis muscle, or down on the trackway that it radiates. And there joint pains that are inflamed are sharp, and they radiate to their local area. pains that are nerve-like, kind of like the funny bone, or sharp at the area and shoot down the line. Persistent dull aching is usually when something has the chemicals of a blister and it's puffy and it's ramping up your signal. And those of you who ever watched the movie Spinal Tap, Tony, I love your post on there, on your the statement after your name. Blisters and the chemicals that make blisters are like 11. There's 10 on the dial, but 11's louder. Yeah. So when you have a pain already, those chemicals that wash that area ramp up your pain signal without doing anything special.